Hi my dear friends, welcome to my channel again. So today I came with a simple letter. It is a suspected case. Okay, so how we have to write if you get one task with suspected case. So how you can find out the case, the type, as I told you before in the previous videos, in the writing task or in the plan, you can find out whether the case, the letter is like suspected case, referral or transfer, or home visit request. So these are all things we can find out in the writing task. So anyway, let us see the writing task. So here the patient name is Miss Glenda Jerrod, date of birth 18/8/1968, height and weight they have given, BMI is 28, social history, teacher, divorced, 3 children at home, non-smoker, drinks mainly spirits, 2 bottles, and substance intake nil, allergies, dust mites, penicillin. Then just you can see the writing task. Using the information in the case note, write a letter of referral for further investigation and definitive diagnosis to the gastroenterologist Dr. Janet Bob at Princess Hospital, 121 Bland Street, Nottingham. So from here you can find out that is the referral letter, but in the plan you can see refer gastroenterologist for opinion endoscopy if required, and you can see provisional diagnosis gastroesophageal reflux plus or minus stricture. So what I mean by provisional diagnosis, it's not get confirmed. So provisional diagnosis means please don't get confused whether it is the exact confirmatory diagnosis or no, this is the suspected. So from here you can find out that this patient's condition is not at confirmed. So for the opinion, you have to write a referral letter to this specialist. So it is a type of referral letter plus suspected case presentation. Then, so we can read the remaining things. Past history: mother hypertension, father peptic ulcer, maternal grandmother died heart attack, age 78, maternal grandmother died asthma attack, paternal grandmother unknown. Paternal grandmother died old age 94. Past medical history: childhood asthma, chickenpox, measles, 1970s tonsillectomy, 1977 sebaceous cyst removal, 1980 whiplash injury, 1990 depression, 2004 dyspepsia, 2006 dermatitis, treatment on oral and topical corticosteroids. 9/7/2011 PCMS is a presenting complaint, and or can is according to the situation we can take as a patient compliance too. So dysphagia, solid food only. Onset is URTI, so they are suspecting it may be because of post-viral URTI. Even that URTI, upper respiratory infection, it's called whether it is bacterial or viral. 2 by 52, that means 2 weeks ago. 52 means that is a 52 weeks in a year, in that 2 week before, that is the meaning. URT is self-medicated with the over-the-counter medication like Chinese herbal products. Contents are unknown. No relapse remittent cause, no sensation of lump, no abuse anxiety, concomitant gastric pain relating to back level T12, weight loss 1 to 3 kg. Recent increase in coffee consumption, takes aspirin occasionally 3 times per monthly, no other NSAID. And provisional diagnosis is gastroesophageal reflux with or without stricture, and the plan is refer gastroenterologist for opinion and endoscopy if required. So this is a simple letter because mostly the nurse to doctor letters are very small in size. So now let us see what are the contents we have to um, keep it in your mind before writing the letter. So here the plan, nothing, we don't have any other plan except it's like a referral. So it is only the referral purpose for maybe for the assessment, and it's done for further investigation and definitive diagnosis. And here you can just put tick mark or star in the name of the patient and the age, divorced, drinks mainly spirits 2 bottles, and allergic to dust mites and penicillin. These allergies are very important. And you can see in the past history there is a family history of peptic ulcer, the mother. Then in the past medical history, only the relevant data we have to take. So the relevant data here, it is dyspepsia, only one time it's had finished already. And even dementia treatment also it's finished. So there is nothing to write, but you can just write maybe dyspepsia. And even dermatitis, it's already finished. because the now the date today is the date is 2011. Okay, then you can see the presenting complaint or patient complaints dysphagia, and we have to write. Then we can mention that patient self-medicated for upper respiratory infection and relapse nothing. Weight loss, it's important. And in the social history, you have to mention the coffee consumption and takes aspirin occasionally 3 times. Then the recommendation paragraph, just simply we have to conclude. So this is the question. So this is a simple question actually. So let us see how to write the answer. So this is a model I can present you. So we'll start with the date 9 July 2011. Dr. Janet Baum, gastroenterologist, Princess Hospital, 121 Bland Street, Nottingham. And the salutation is Dear Dr. Bob. So we will write the surname. Patient name is Glenda Jerrod. Date of birth is 18 August 1968. So I hope it's clear up to here. Next one, we are going to write the purpose paragraph or introduction paragraph. So I am writing to refer Miss Glenda Jerrod, who is suspected to have gastroesophageal reflux. She requires specialized assessment and further investigations. She is said to be transferred into your care today. So this is like a symbol. Within 3 sentences, we can conclude. It is like a referral letter, so we can write, I am writing to refer Miss Glenda Jerrod. Here, the patient's full name should be here. It should be there. Who is suspected to have. So this is a format for suspected cases, like suspected to have gastroesophageal reflux. There is no need for with or without stricture. It's enough. She requires the requirement for the patient is specialized assessment and further investigations. Then she is said to be transferred into your care today. So it's clear. The next one is the body paragraph. Actually, in the body paragraph, nothing is there to write. Um, Nothing special, but we can write Miss Jerrod here. Only the surname should be there. Presented on. So if the patient admitted, should be was admitted. Presented, you can write simply presented on 9 July 2011 with the compliance of dysphagia to solid foods and radiating gastric pain. That's enough. If you have only one clinical manifestation or complaint, you can write with the complaint of complaint. If there are more than one, you can write with the compliance of dysphagia to solid foods and radiating gastric pain. Then, in addition, comma, she has weight loss. So the need of an opinion from specialist is essential because we don't have any other relevant data to write here. So you can just include, just you can write the conclude. You can write a conclude sentence here also. So the need of an opinion from specialist is essential. Just like you are mentioning that this is the reason, nothing but we have to be refer the patient to you. Next one is the social and medical paragraph. Miss Jerrod is a divorcee. So this divorcee, the word is common for male and female. And if you need to write widow, widower, widow is for female, widower is for male. So Miss Jerrod is a divorcee. She is a regular drinker. Recently, she has increased coffee consumption. She had upper respiratory tract infection a few weeks ago and treated with the herbal medications. She has family history of peptic ulcer. Occasionally, she takes tablet aspirin. She is allergic to dust mites and penicillin. So here, this past thing, she had upper respiratory tract infection a few weeks ago and treated with herbal medication. This sentence, if you need, you can write it in the second paragraph. In the here it's okay. So the need of and before the sentence you can write she had upper respiratory tract infection a few weeks ago and treated with the herbal medications. Then you can write this may be the reason for her infection. So the need of this may be the reason for her current condition. So the need of an opinion from specialist is essential. So if you need, you can write in that way too. Anyway, I wrote here she had a respiratory tract infection a few weeks ago and treated with the herbal medication. So she has family history. Then we have to mention regarding the family history. She has family history of peptic ulcer. Occasionally, she takes tablet aspirin because there may be the connection between these tablets and this genetic history. She is allergic to dust mites and penicillin. So that's all our social and medical paragraph. Then the last one, because we are writing to a doctor, so mostly in the recommendation paragraph it will be very small. Kindly take over the case of Miss Jerrod and provide specialized management. Please note that she may require endoscopy to rule out the definitive diagnosis. So here this is common for all doctors. Kindly take over the case, because for us nurse to nurse we could not tell that take over the case. This is only to the specialized, I mean to the doctor or specialist. So kindly take over the case of Miss Jerrod and provide specialized management. Please note that she may require endoscopy to rule out the definitive diagnosis, because it's a provisional diagnosis. So they have to confirm the diagnosis and how to treat. Then we will conclude yours sincerely, registered nurse. Sorry, there is a mistake. After yours sincerely, there is no comma. That registered nurse. That's all. So I hope it's clear for you. So once again, I will show you the paragraph. So this is the starting. I am writing to refer Miss Glenda Jerrod, who is suspected to have gastroesophageal reflux. She requires specialized assessment and further investigations. She is said to be transferred into your care today. Then, Ms. Jerrod presented on 9 July 2011 with the compliance or dysphagia to solid foods and radiating gastric pain. In addition, she has weight loss. Then you can add the sentence which I told you here. It's like optional. You can write either here or there. She had upper respiratory tract infection a few weeks ago and treated with the herbal medications. This may be the reason for her present complaint. So, the need of an opinion from specialist is essential. Then the social history and medical history paragraph. Ms. Jerrod is a divorcee. She is a regular drinker. Recently, she has increased coffee consumption. It's like optional. I told you, if it's not written there, you can present it here. Then she has family history of peptic ulcer. Occasionally, she takes a tablet aspirin. She's allergic to dust mites and penicillin. The recommendation paragraph is kindly take over the case of Miss Jerrod and provide specialized management. Please note that she may require endoscopy to rule out the definitive diagnosis. Yours sincerely, registered nurse. So I hope it's clear for you. And for the doctor, if you're writing the doctor, your letter should be standardized when we are comparing with the nurse to nurse. So that is only the thing, and you can use kindly take over the case. That is common for all letters to doctors. So if you have any comments, please put it in the comment box, and we will see it in the next video. Okay, thank you.